So, have you ever stopped to think about how your upper body weight effortlessly transfers down to your legs? Or how your body manages to do that while simultaneously protecting some of your absolutely most vital organs? Well, it all comes down to the brilliant structural architecture of the bony pelvis. Okay, let's dive right into this incredibly dynamic bony basin in today's straightforward, beginner-friendly pelvis anatomy explainer.
To keep things simple and avoid getting totally overwhelmed by complex medical jargon, we're going to use a structural, top-down approach to map out this entire framework. We'll start with a quick pelvic skeleton overview, zoom in on the anatomy of the hip bone, check out the sacrum and coccyx, break down the true versus false pelvis, and finally, wrap up with the pelvic inlet and outlet.
Section 1. The pelvic skeleton overview, the body's bony basin. Let's get right into the big picture.
Our primary focus here is understanding how this strong, rigid frame works. It protects internal pelvic and abdominal pelvic organs, all while performing the heavy-duty task of transferring weight from our spine directly to our lower limbs. It all starts with four main elements. We have the anterior pelvic girdle, which is made up of the two large paired hip bones on the sides. Then, right in the back, we have the posterior pelvic spine, containing the sacrum and the much smaller coccyx tucked underneath. Together, the whole shebang forms one complete continuous ring.
Now, this part is often misunderstood, but it's absolutely crucial. There is a distinct architectural difference between the male and female pelvic skeleton. The female pelvis is structurally broader and shallower, featuring a wider oval-shaped pelvic inlet that's specifically adapted to form a natural childbirth canal. Conversely, the male pelvis appears much more massive and taller, complete with a heart-shaped inlet and a narrower pubic arch.
Moving right along to Section 2, Anatomy of the hip bone, ilium, ischium, and pubis.
Looking closely at a single hip bone, also known as a coxal bone, you might think it's just one giant, irregular piece of bone. Actually, scratch that. It's three. Each hip bone is composed of three smaller bones, the ilium at the top, the ischium at the bottom back, and the pubis at the front. These three distinct bones completely fuse together during early adolescence to create one solid, incredibly strong structure.
Before we break down those three individual bones, we really need to understand their critical fusion point, which is known as the acetabulum. You can literally think of this as the ultimate socket. All three bones, the ilium, the ischium, and the pubis, meet right here to form this deep cup-shaped cavity.
So the crucial point about this deep acetabular socket is that it actively receives the spherical head of the femur. This creates the hip joint, providing massive structural stability for things like walking and running. And right below that socket, you'll notice a massive opening called the obturator foramen. While it's mostly closed off by a membrane, it leaves a tiny gateway, a small canal, for very important vessels and nerves to pass through safely.
Okay, taking apart the hip bone piece by piece, we first find the ilium. This is the massive uppermost portion of the hip bone. It flares out into this wide blade-like wing, acting almost like a structural bowl. This bowl bounds the greater pelvis laterally and actually supports our lower abdominal organs.
Next up is the ischium, which is the heavy, curved, posterior-inferior portion of the hip bone. Fun fact, if you're sitting down right now while listening to this, you are actually bearing your body weight on a massive, rough area of this exact bone called the ischial tuberosity. It acts as our primary weight-bearing foundation for seated posture and anchors some really crucial lower limb muscles.
Finally, completing the hip bone is the pubis. This forms the curved anterior or front segment. The pubis from the left hip bone meets its exact counterpart from the right hip bone directly at the front midline of the body. They join together at a cartilaginous joint known as the pubic symphysis, completely sealing the anterior pelvic ring.
Section 3. The sacrum and coccyx, the pelvic spine. Let's shift our focus to the back.
Think of the sacrum as the keystone of an architectural arch. It's a large, inverted, triangular bone made of 5 fused vertebrae. It sits directly at the base of the spine, and it strongly anchors the entire pelvic ring by articulating with the ilium on both sides at the sacroiliac joints. Also notice these anterior foramina. These little holes? They act as a highly organized network for transmitting spinal nerves and blood vessels.
Attached right below the apex of the sacrum is our coccyx, which we all know as the tailbone. While it might just look like a tiny, useless remnant formed by 4 fused vertebrae, it's actually quite functional. It serves as an essential attachment site for various pelvic floor muscles and ligaments, and it even helps bear some weight when we lean back in a chair.
Section 4. True versus false pelvis, the functional spaces. Now here's where it gets interesting.
Beginners often have a tough time visualizing the internal 3D space of the pelvic cavity, but we basically divide it into two parts, the false pelvis and the true pelvis. First, the false, or greater pelvis. This is simply the expanded, open space situated above the pelvic inlet. It's bounded laterally by those large, blade-like iliac wings we talked about a minute ago. From a functional standpoint, it acts almost like a lower extension of the abdominal cavity, holding and supporting the lower intestines.
Conversely, as we move lower down into the structure, we enter the true or lesser pelvis. This is the much deeper, cavity-like lower portion. This highly protected bony vault is what actually houses the vital urinary and reproductive organs, like the bladder, as well as the uterus and ovaries in females.
And finally, Section 5, pelvic inlet and outlet, the birth canal.
What's really fascinating about this structural architecture is how it forms a perfectly measured, functional pathway for childbirth. Think about it for a second. How does this complex, multi-bone ring create a specifically defined and measured opening for a baby to pass through safely? Well, the boundaries are actually extremely precise.
The answer lies in the pelvic inlet. It's defined by a continuous bony rim, mapped by something called the linea terminalis. Starting from the sacral promontory in the back, sweeping right along the ilium, and meeting at the pubic symphysis in the front, this rim acts as the literal anatomical doorway separating the false pelvis up above from the true pelvis down below.
Because this doorway is so vital, in obstetrics, the exact diameters of this inlet are critically measured. For example, the anatomical true conjugate averages about 11 centimeters. These specific lengths, the transverse, the oblique, and the various conjugates, they totally determine the size and shape of the birth canal, ensuring there is a safe delivery space for the baby's head to pass.
And when we map these measurements out, you can really see how they stretch precisely across the physical landmarks we just learned about. Imagine a line drawn directly from the middle of the sacral promontory all the way straight across to the superior border of the pubic symphysis. It's honestly a complete marvel of anatomical engineering.
Concluding our journey, we reach the inferior opening of the true pelvis, the diamond-shaped pelvic outlet. Bounded by the pubic symphysis in the front, the ischial tuberosities on the sides, and the coccyx at the very back, this space forms the lower exit margin of the true pelvis, safely guiding the fetus completely out of the canal.
It's truly incredible, isn't it? How one complex bony structure masters both the massive mechanical demands of human mobility and the functional miracle of life. I really hope this structural breakdown made a tough topic much easier for you to visualize. So, what part of pelvis anatomy do you find the most confusing? Let me know down in the comments, and please subscribe for more simple visual medical explainers to keep exploring with us.